Low-dose naltrexone increases what's called OGF and OGF receptor. These are little peptides, basically proteins, that when connected together inside the cell, they give a signal to the nucleus that inhibits the cancer cell production. The amazing thing that they found is this is present in 90% of the human cancers. Over 47 different lines of cancer, they've shown that this mechanism is present. And after reading their papers regarding this, I found the science to be good enough to be legitimate to try for people who have cancers that really have no other choice, stage 3, 4 cancers that really are done with their therapy. It also increases what's called the P16 and P21 pathways that are the key components to inhibiting the cancer cell division. And what they found, interestingly enough, is in the cancer cells, they don't have a lot of OGF and OGF receptors. So what it does is it boosts the body's own way of inhibiting cancer cells. We don't know that it really destroys tumors, it just inhibits cancer cells from dividing. So in doing so, I took it upon myself to do research on it before I would use it. You know, I'm a scientific type of person and like the science to be there. Dr. Zagan published articles regarding ovarian cancer cells specifically with naltrexone and OGF. And since ovarian cancer is the 4th leading cause of cancer mortality with women, and it's the leading cause of gynecological cancer, this is a tough cancer and very critical to understand the cancer mechanism. And they found that the OGF receptor mechanism was present there. They showed it reduced the cancer cell proliferation. And he's had a number of other articles showing the same thing. So I have a patient who in 2004 had initial ovarian cancer. And as Dr. Zagan points out in his article, 65% of the patients with ovarian cancer recur within 2 years. Well, she went 6 or 7 years, and then she had stage 4 metastatic ovarian cancer everywhere. Her spleen, liver, colon. She had the surgery, she had some chemo, and then she heard about me through a friend, and so I started her on low-dose naltrexone in 2011. And as a matter of fact, I just talked to her 2 days ago. She's doing very well. Her liver metastases have stabilized, and she's now in a stable state. And this is for 4.5 years later, which is significant because I was anticipating that she wouldn't have lasted more than 4 or 5 months with metastases through her whole abdominal wall cavity and the other areas I mentioned. I had another patient who, at 38 years old, had discovery that he had stage 4 squamous cell carcinoma of the tonsil. And he was treated with the usual chemotherapy, radiation. He elected not to have a radical neck dissection. He just said, I'm not doing that. So about 8 months goes by, and he's just not doing very well. He was tired, fatigued, and so I said, well, come to my clinic. I did a bunch of body chemistry tests, hormone levels, and found that the chemo and radiation destroyed all those, which is very common. Once I got those balanced, he's feeling better now, and he's doing great. But I also put him on LDN. And squamous cell carcinoma of the tonsil does not do very well when you're stage 4. This is 4 years later now. There's no signs of cancer. His oncologist says we really don't even have to follow the PET scans anymore because there's really no evidence of anything recurrent. And he now is doing very well. He's doing worldwide trips, working 2 jobs, and he takes the 4.5 milligrams every day and hasn't had a problem since. In regards to how well he's done, well, maybe half the people last 5 years with that diagnosis. He met 2 other men who had the same diagnosis, same exact diagnosis when he was at MD Anderson. They have now both passed away, a couple years ago. So that, as long as he lives, it's another telling sign that LDN can be very positive for people, long term, in maybe preventing the recurrence by inhibiting any other cancer cells that are residing or starting to arise again.